and that it can increase the chemotaxis, the mobility of fibroblasts, which make up some of the skin tissue and give rise to the appearance of more youthful skin. There's also evidence that ingestion of hydrolyzed collagen peptides can improve the elasticity of the skin barrier on the outside, right? Make it look nice and taut. If I guess we say nice, we're sort of passing subjective readout on this. Make it appear taut through the increase of certain proteins unrelated to collagen, such as filagrins, elastins, etc. What about other peptides? Okay, so this is a big topic nowadays, especially in the online communities. I did an entire episode of this podcast about peptides. Keep in mind that insulin is a peptide. Ozempic, what is essentially an agonist for glucagon-like peptide 1. This is a very popular prescription drug now for the treatment of obesity and for the treatment of diabetes. There are lots of things that qualify as peptides. A peptide is simply a small chain of amino acids. A polypeptide is a bit longer chain of amino acids, and then proteins are made up of amino acids. Okay, so when we say peptides, that means many, many things. But these days, when you hear about quote unquote peptides, especially in online communities, generally people are referring to exogenously given, okay? So pills, ointments, or more typically injections of peptides that are designed to achieve some specific biological or physiological outcome. And one of the more common of these peptides being used nowadays is one that I've talked about before called BPC-157, Body Protection Compound 157, which is essentially a synthetic version of something found in gastric juice in all of us. It's known that certain peptides within the gut that BPC-157 is known to mimic, or it actually is a synthetic version of that exact sequence or a portion of that sequence, can assist in tissue and wound repair of different kinds, tendon, anything involving fibroblasts. All of that has been well demonstrated in vitro in a dish, okay, so not in vivo, as well as in vivo in certain cases, but only in animal models. To my knowledge, there's only one study, and frankly, it's not a very good study at all, on BPC-157 in humans, and yet a lot of people are taking BPC-157 either orally in the form of a capsule or pill, or more typically injecting it. What does it do, or what does it likely do in humans? We know from animal models that BPC-157 increases angiogenesis, the growth of capillaries and blood vessels. We know this. It can accelerate wound healing by virtue of increasing fibroblast motility. For this reason, it's used post-injury in sports. It's used by people who want to build more muscle. It's used by endurance athletes. It's used for cosmetic purposes. Anytime people are using BPC-157 for any of those purposes, it's likely that they're using it in part to increase the blood flow that's available to a given tissue and the repair of that tissue. Now, again, I do want to caution people that there is very little, basically no evidence in humans besides the anecdotal evidence that people say they healed faster. What I do know is that anytime you get vascularization of tissue, you're going to get improved blood flow. So it all makes sense mechanistically. I also know that vascularization due to BPC-157, even if it's injected locally into a given tissue, is likely to occur globally throughout the body. This is why some people taking oral BPC-157 or injecting it, just subcutaneously at the level of, their stomach, a little bit, under the skin at the level of their stomach, report faster wound healing even in a distal limb or like a hand or a nerve injury in their foot or something like that. That also tells us that there's going to be increased vascularization of other tissues, such as skin, such as tumors, if tumors exist. So you need to be very careful. I need to say that up front as a cautionary note because it is very clear that many people are starting to either inject BPC-157 or apply it in the form of a topical cream in effort to get more vascularization of skin in order to make that skin appear more youthful. And more products are out there that contain BPC-157. I can't in good conscience recommend those products. I can only offer to you the likely mechanism by which they work, if they work, and also offer you the caveat that it is unclear that BPC-157 can go transdermally if it's applied topically. So if you put it on a, say, wrinkly portion of your face, so like I've got crow's feet. Crow's feet come from either aging, smiling, or both. The crow's feet are the kind of wrinkles that extend out the corners of your eyes when you smile, or for me, because I'm, 48, probably do that even when I don't smile. The logic would be that if you take a cream containing BPC-157 and you put it on there, that you'll get increased vascularization of that area, delivery of more growth factors and nutrients, and those wrinkles will either be halted in their aging progression or that they will reverse. That's the logic. To my knowledge, there are no clinical studies, And I'd love to know from you if you've tried these products. Please put your experience of those in the comments on YouTube so we can get a sense of whether or not people are having good results with this. That, of course, is not a controlled study, but I'm very curious as to know. Many of the products that contain BPC 157, by the way, also contain copper. Copper is a trace mineral. It's found in your diet. There is some evidence that copper is important for some of the collagen and other elements of skin synthesis pathways. And so the mechanistic logic and the biochemical logic is there on paper. However, it's also clear that ingesting too much copper can induce an inflammatory response and would lead to the exact opposite desired effect that people who are using copper, and usually copper BPC containing products, are taking them for, which is to halt or reverse the appearance of aging in their skin. Why am I going through this whole gymnastics of, BPC 157 and copper? Well, because nowadays, many products are starting to include quote unquote peptides for skin rejuvenation. And most often those peptides are of the copper variety, of the BPC 157 variety, and oftentimes also with things related to collagen synthesis, sometimes collagen directly. So you'll find oral products that one takes by pill form that are BPC 157, copper, and collagen, or things that promote synthesis of collagen. You'll find ointments that are pure BPC 157, still unclear if those go transdermal. Okay, so this is still a very young science, and most of this is not being explored in randomized controlled trials. However, I know some of you out there are pretty experimental. You like experimenting with this kind of stuff. You like hearing what's working for other people. Here's what I suggest. If a sunscreen or a lotion or a pill or an injection is asserted to contain peptides to help with skin rejuvenation, make sure you look and see which specific peptides are included. Know the risks associated with BPC 157. It's uncertain risk about acceleration of tumor growth, but the mechanistic logic is just as strong for that with BPC 157 as it is for BPC 157 encouraging vascularization of any other tissue, muscle, tendon, ligament, or skin for that matter. So I'm not telling you what to do, just know what you're doing and understand the likely mechanisms behind it in the absence of any of these randomized controlled trials. I will say, in service to making sure that your diet and or supplementation includes enough trace mineral copper. Copper has been shown to play a key role in DNA repair, which is a critical component of the turnover of collagen and other proteins in skin. It has been shown to reduce so-called reactive oxygen species, so it serves as a so-called antioxidant. And this relates to what I just said, reduced inflammation, but too much copper is a problem. So I wouldn't run out and start supplementing with excessive amounts of copper. Please don't do that. But you want to make sure that you're getting sufficient amounts of copper from your diet. And you can simply look up online what sufficient amounts of copper are, given it's a trace mineral. And it's very likely that if you ingest any kind of supplement that is a multivitamin mineral supplement or a foundational nutrition supplement, that includes at least some copper. So it's likely that you're sort of quote unquote topped off in terms of the amount of copper that you need, but very unlikely to be excessive amounts of copper. But if you start supplementing with copper beyond that, again, you can induce an inflammatory response. So it's a dosage kind of middle ground issue there. You don't want your copper too low. You don't want your copper too high. You want it right there in the middle. Okay, as I mentioned before, we will talk about other components of food that are great for skin health. And we will also talk about components of certain foods like advanced glycation end products. I don't know if you've heard of those before, but very interesting, not good stuff that you want to avoid if you can, especially if your concern is youthful looking skin and healthy skin, and frankly, health overall. But before we do that, I think it's worth paying attention to a few things that you can potentially take that can really improve the youthfulness of your skin, for which there is excellent science to support it. Okay, so when I spoke to board certified dermatologists who trained at excellent institutions, what people can do to improve the youthfulness or the appearance of youthfulness in their skin, and that there specifically be peer-reviewed studies to support their statements. They mentioned hydrolyzed collagen protein in combination with vitamin C. We talked about that earlier. They mentioned a bunch of do's and don'ts as it relates to sun exposure and nutrition, etc., some of which we've covered, some of which we are yet to cover, but will soon. And they mentioned supplementing with niacinamide. Niacinamide is a form of vitamin B3. It is also sometimes referred to as nicotinamide. And I was told that when taken at twice per day, at a dosage of 500 milligrams per dose for a total of 1 gram or 1,000 milligrams per day, that niacinamide supplementation can increase the production of ceramides, which relate to the lipids in skin that improve the moisture in skin. And by the way, moisture in skin is a key component of the youthfulness or plump appearance of that skin. And when I say plump, I don't necessarily mean outwardly rounded plump. I mean the fact that the skin looks like the outermost layer of the skin, which you now know as the epidermis, is kind of taut, and the skin looks hydrated and smooth at the level of its outer appearance. All of that is improved by niacinamide supplementation, but that the supplementation has to be carried out for 3 to 6 months or more before that effect is noticed. Now, the origin of the niacinamide effect on the youthfulness of skin could also be related to the fact that there's evidence that niacinamide supplementation can reduce inflammation of skin overall. We haven't talked so much about the immune-skin relationship, although as I alluded to at the beginning of the episode, this is a key relationship. But for those of you suffering from rosacea, from acne, so rosacea being a reddening of the skin, we're going to talk more about it later and specific things that can be done for it. Acne almost always involves some reddening, often painful reddening of specific pocks on the skin, sometimes even the appearance of pus-filled bumps, this sort of thing. That niacinamide supplementation may also assist there because of the reduction in inflammation, and we'll talk all about the relationship between inflammation and acne. Regardless of whether or not you suffer from rosacea or acne or not at all, that niacinamide supplementation may benefit you. Also, because niacinamide supplementation appears to balance the level of oil production in the skin. You need oil in the skin. You need oil down in those pores, but not too much. And that it can definitely help reduce the appearance of clogged pores. And if you're concerned about pores that appear too large, this typically happens in the face, around the nose, on the upper cheeks, although other regions of the body as well, niacinamide supplementation may assist with that as well. There's also a number of people out there that are concerned with specific spots that they see as hyperpigmented spots. So regardless of whether or not overall your skin is very light or very heavily pigmented, supplementation with niacinamide can reduce the appearance of accumulation and maybe even the actual accumulation of melanin at particular spots, so-called dark pigmented spots that some people decide that they don't want for whatever reason, usually just cosmetic reasons, although there may be reasons why hyperpigmentation in a given area could relate to skin cancers. We talked about that earlier. Another reason to go get not just your moles, but all of your skin checked at least once per year. Now, if you decide to supplement with niacinamide, you have the option of either taking that 1,000 milligrams in 500 milligram dosages per day. You also have the option of using any number of different topical niacinamide ointments or serums that exist out there. Keep in mind that many skincare products already contain niacinamide, so check the label. And there, the dermatologists tell me that to be effective, the niacinamide needs to be present at least a 2 and as high as 10% concentration within those ointments or serums. Keep in mind that many serums and ointments also contain what's called hyaluronic acid. Hyaluronic acid is a natural component of the skin that provides a physical substrate for holding in water, so moisture within the skin. It does a bunch of other important things too within the extracellular matrix and elsewhere, the regions between the cells, that is. And supplementation with hyaluronic acid or ointments or serums that contain hyaluronic acid and niacinamide are pretty common out there because of the already stated effects of niacinamide and the fact that hyaluronic acid can serve as what's called a humectant, something that serves to sort of barrier in moisture at the level of the skin. Okay, so it gives that kind of plumping, moist look of skin that's characteristic of youthful skin as opposed to aged skin. The dermatologists and the cosmetic surgeons that work on faces that I spoke to, I told you I consulted with a fairly large and diversified group of folks in preparation for this episode, all agreed that supplementation with collagen, vitamin C, niacinamide, and hyaluronic acid was something that they suggest to their patients. The other supplement, well, actually, it's a prescription treatment most often that dermatologists recommend if the goal is youthful appearing skin, are things within the so-called retinoid pathway, such as retinol. Okay, many of you have perhaps heard of this, and it's a whole story related to the relationship between vitamin A and skin. Okay, so tretinoin is the common name for it, although some of you may know it as Retin-A, and prescription drugs that are similar to that are basically derivatives of vitamin A. Why? Why are these used for skincare? Why are they used to increase the youthfulness of skin? Well, vitamin A gets into skin cells and is converted into something called retinaldehyde, then into something called retinoic acid. Now, very important to know that retinoic acid is involved in a lot of different cellular processes, especially during neural development. This is why, and please pay careful attention to this, this is why women who are pregnant or breastfeeding should avoid taking these products because it can seriously disrupt the development of the fetus. Okay, and keep in mind that many times people don't realize they're pregnant for some period of time. So this is of paramount concern. Okay, we could have a whole discussion as to the role of retinoic acid in fetal development, but you don't want to tamper with that pathway. Okay, very serious consequences can occur. Okay, so when retinoic acid gets into cells, it can activate what's called transcription factors. Transcription factors bind to DNA, okay, your genetic code, and can induce the transcription and translation of DNA into RNA and RNA into proteins of particular types. So think of transcription factors as sort of setting a menu of different proteins that ultimately will be formed, okay? By binding to DNA, and then you get DNA to RNA, RNA to protein, and you're getting a set of proteins related to a particular process. That's generally how transcription factors work. And retin A, tretinoin, and things similar to that are going to induce the formation of collagen protein within skin, as well as other proteins that relate to the formation of de novo skin, new skin, and can replace old degenerated skin. So the dermatologists that I spoke to were really bullish about the fact that, believe it or not, they felt that people starting in their 20s could very well, as long as they're not pregnant or lactating or planning to get pregnant, could take retin A or things similar to it in order to stimulate the production of more skin and look more youthful. Now, for people already in their 20s, by my age, they're already youthful, but that they could initiate the use of these compounds at least in one's 20s and continuing on really as long as they wanted through life. And they told me about, quote, remarkable results. So I said, well, why isn't everyone aware of this? Why isn't everyone taking them? Well, it turns out that these different compounds can also increase sensitivity to light, make you more prone to sunburn, to some of the other effects of light on skin, even from screens or from artificial light. So one has to be careful about inducing too much skin sensitivity to light of all kinds, not just sunlight. That they can also induce some redness or dryness. So one has to get the dosage right, the frequency of use right. And they can be a little bit tricky to work with, but that if one can home in on the right dosages, the right frequency, etc., the dermatologist felt like this was one of the best things that one could do to improve the youthfulness or the appearance of youthfulness in one's skin. Now, I find this interesting for a number of reasons. First of all, I've heard of retin A, right? I've heard of these compounds before, but I hadn't heard about all these, reportedly spectacular things like improved angiogenesis, vascularization of the skin. This is why people are taking the rather experimental, untested BPC-157 that I talked about before. The improved elasticity of skin, which somehow seems related to the ability of these compounds to remove degenerated elastin within the skin, to clear that out, as well as to induce de novo synthesis and even the number of different fibroblasts that are present in skin. So more new skin, clearing away of old skin, improved vascularization. And while all of this sounds a little bit too good to be true, the mechanisms by which it's asserted to work all hold up. So that's always reassuring, right? Mechanism isn't everything, but it's really nice to see there. For instance, these compounds are known to get into the nucleus of cells, right? To impact gene expression. We talked about that before. You have receptors on the surface of cells. Okay, so cell surface receptors. You also have nuclear receptors and the ability of certain things, we call them ligands, but these are chemicals, right? In this case, in the vitamin A pathway to get into the nucleus of cells and impact gene expression. This is actually how hormones like testosterone and estrogen change the way that people look so dramatically during puberty. They actually, they operate by binding to cell surface receptors. They also get into the nuclear compartment of the cell. They bind to nuclear receptors and they turn on entire genetic programs that cause, for instance, deepening of the voice or the growth of hair or breast tissue, etc. So these are powerful compounds. Now, I talked to a cosmetic surgeon expert in face specifically. Remember, cosmetic surgery is done for a number of different areas of the body, but for face specifically, who also specializes in these sorts of treatments for skin. And they've started using and are frankly quite confident in the use of retinoid esters that can be applied to the surface of the skin. So these things are available not by prescription. There's far less research on these sorts of compounds, but these compounds get enough positive support from the people that have tried them, reporting improved youthfulness of skin, etc., that some of them are becoming quite sought after and people, let's just say, are very enthusiastic about them. And I will say that in discussing the various mechanisms of this with these cosmetic surgeons and some dermatologists, the logic holds up. So you're starting to see more and more of these. Now, as I mentioned at the beginning of today's episode, there is zero business relationship between me, the podcast, or any of these people that have marketed serums or creams or prescription drugs for that matter related to skin health and skincare. However, I have provided a couple links in the show note captions of some of the different sources of these. Obviously, if you need a prescription for something like tretinoin or something similar because you're interested in this whole retinol, retin A, vitamin A pathway story, you need to talk to a board-certified dermatologist who could potentially prescribe that for you if they decide it's right for you. But in terms of these topical ointments and serums and creams and things like that, I do provide a link to at least one source of those that uses the retinoid ester. Just keep in mind that these various ointments and serums do not yet have the randomized controlled trials to support them that some of the other compounds that we were discussing do have. Now I'd like to talk about things that one can do to improve the health and appearance of one's skin that don't involve taking anything or putting on any kind of ointment or serum or anything like that. And what I'm referring to is phototherapy. Now, at the earlier part of the episode, I talked about how different wavelengths of light, like UV light and long wavelength light, can penetrate skin to different depths, and some of the negative, but also positive things that can do. So, for instance, we talked about UV light mutating DNA in cells and potentially causing cancers, accelerating the aging process, and so forth. But as you also recall, long wavelength light, so-called red light, and near infrared light, which is even longer wavelengths of light, can penetrate deep into the skin tissue, so past that outer epidermal layer into the dermal layers of the skin, and can access the vasculature, the neurons, some of the glands located deeper in the skin, and of course, the cells there, like cells in the epidermis, I should point out, contain things like mitochondria for which red light has been shown to be beneficial. Why? Red light and near-infrared light phototherapy has been shown to reduce reactive oxygen species and thereby to improve mitochondrial function in cells. And that in turn has been shown to be beneficial for all the different processes within cells that involve mitochondria, which of course include energy production, but a bunch of other things too. So when I say that phototherapy has been shown to be beneficial for cells of the body, it's not just cells of the skin. In fact, a Nobel Prize was granted in the early 1900s for the use of phototherapy for the treatment of lupus. So this is not a new technology. At the same time, while there are many studies exploring the use of phototherapy for improvement of skin health and appearance, most of those studies have fairly low sample sizes, but there are a lot of those studies. And fortunately, by now, there are a few meta-analyses and reviews that take into account lots of different studies using slightly different wavelengths of light applied to different portions of the face for different purposes, treatment of acne, maybe even putting red light, near infrared light on one half of the face to have a so-called within-person control to compare, the changes in skin or lack of changes in skin, as the case may be, between one side of the face and the other. I'll put links to some of these studies and some of the meta-analyses and reviews of these studies. One that I like in particular was published in 2018 entitled Light-Emitting Diodes in Dermatology, a systematic review of randomized controlled trials. Of course, randomized controlled trials being one very powerful way to analyze the utility of a practice or a compound. It's not the only way to assess the utility of something. I know some people argue that they are very useful, but keep in mind, in the field of medicine, we often have entire fields or even entire chapters of medical books that are based on case studies. For instance, we implicate the so-called hippocampus of the brain for its function in human memory, which it absolutely has. And that fact largely grew from one major case study that then exploded into a number of different animal model and then human studies later on. So we all love randomized controlled trials, reviews of randomized controlled trials and the uses of phototherapy for treatment of skin conditions and improving the quality of skin are wonderful and point to the fact that phototherapy can indeed improve the appearance of skin in conditions like acne, can accelerate wound healing, can improve the youthfulness appearance of skin, but these effects tend to be somewhat mild to moderate when they occur, and certainly there are many studies that show no significant effect, no statistically significant effect. That said, I'm of the belief, based on my read of the literature, and this is a literature I've spent a lot of time with, frankly, because I did an episode all about light and health. I've also been very interested in the use of phototherapy for the treatment of eye diseases and offsetting age-related decline in visual function. There's some interesting evidence there. Again, mild to moderate effects, but that can be meaningful in the real world. And when I step back from all of the literature, here's what I see, and this is what I ran by a dermatologist to make sure that they thought that this protocol would be useful or not useful, right? I asked them, I didn't tell them, do you think this will be useful? Tell me yes. I asked them. And what we basically converged on was that if somebody decides to do phototherapy, the use of phototherapy that involves long wavelengths of light, so red light plus near infrared light typically, at a distance of about 1 foot to 2 feet from the light source, depending on the intensity of the light source, although that doesn't seem to be so critical, but one can't be across the room from the red light source, nor should one get right up next to the red light source so that there's a lot of heat generated from the red light source that one can feel. But at a distance of about 1 foot to 2 feet away at fairly high intensities, done for anywhere from 10 to 15 minutes, 5 to 7 days per week, on a consistent basis, does seem, on average, to lead to improvements in the youthfulness appearance of skin. Why this would be the case isn't exactly clear, but there are a number of different logical interpretations, such as reduced inflammation, improved mitochondrial function, all downstream of reduced reactive oxygen species, improved blood flow to that particular area because of the effect that long wavelength light can have on vasodilation, sort of expansion as opposed to contraction of blood vessels and capillaries. All of this makes mechanistic logical sense, and the effects that one sees in these various peer-reviewed papers, randomized controlled trials, seem pretty good, meaning they are mild to moderate. None of them are sort of jaw-dropping like, wow, complete reversal of severe acne or, massively accelerated wound healing. And we also, of course, have to take into account that many people who are doing phototherapy often are combining it with other things. Sometimes in today's era, like injections of BPC-157 or the use of hyaluronic acid or niacinamide, etc. So these things aren't always being examined in isolation, but when we look at this literature, I think it's fair to say that there is now substantial evidence for the use of phototherapy for improving the quality of skin, and in some cases for reducing the symptoms of acne, reducing the symptoms of psoriasis, basically any condition where improved blood flow, lowered inflammation, fewer or reduced oxygen species, improved mitochondrial function, delivery of nutrients, anytime some or all of those things are going to be involved, phototherapy makes logical sense. And so it's no surprise that we're seeing increased evidence for phototherapy in these conditions. Now, I've provided a link to the review of the randomized controlled trials that I mentioned a bit ago. I also provided a few links to some specific studies that show pictures of before and after, in some cases on two sides of the very same face. I did an entire episode about light and health. I'll also provide a link to that episode. And if you don't want to listen to or watch that entire episode, you can go to specific timestamps in that episode to learn about the uses of phototherapy for the treatment of skin, eye, and other conditions related to mental health and physical health. Now, keep in mind that when people hear phototherapy, they almost immediately think about a device. And that makes sense, right? Red light, near infrared light. However, if you recall, there's this thing called the sun that emits full spectrum light, which of course includes red light and longer wavelengths of light. Okay, so just because you can't see those longer wavelengths of light, that doesn't mean they're not there. Just like UV light, you can't sense UV light with your eyes. By the way, ground squirrels and some other animals can. It's thought to be the case that they have photoreceptors to detect UV because they actually, this is sort of strange, but interesting, you'll never forget this, that they'll take their urine and they'll spread it on their stomach with their little paws, and they'll stand up and they'll like signal flash one another from across the prairie or whatever it is, across the lawn to signal to one another. So they're sending UVP signals across the lawn. I'm not making this up. I actually studied a little bit of this when I was an undergraduate, but not at the level of the urine and the signaling, at the level of the retina. Any discussion about skin has to include a discussion about nutrition. Why? Well, remember the fact that I mentioned at the beginning of today's episode that your skin and your immune system have a very intimate relationship. It's bidirectional. Your skin reflects the status of your immune system in many ways. And this is why many people with autoimmune conditions, things like lichen planus, you can look it up, or if you mind particularly striking photographs, please don't look it up. But people that have autoimmune conditions, that often manifests in skin conditions. We'll talk more about this in the context of psoriasis in a little bit. But anytime we're talking about the immune system or skin, we need to take into account the gut microbiome and nutrition. So many people asked, what are the things that they should eat to have healthy appearing youthful skin? They also asked, what are the things that one eats that could exacerbate things like acne, and what can one eat in order to reduce their acne? So let's just start off with the basics. And here I'm going to be fairly brief because I think we all know the the big take-home message about nutrition nowadays. We hear over and over again, and we should pay attention to the fact that the vast majority of our food, well, I should say, if one desires to be healthy, mentally healthy, physically healthy, and a high-performing individual in any number of different things, cognitive, physical, or otherwise, we want to consume the vast majority of our foods from non-processed or minimally processed sources, so-called whole foods, so fruits, vegetables, if that's within your diet. Some people include grains, some people don't. I'm not here to discuss that. Meat, eggs, fish, chicken, and so forth, if that's within your diet plan or your nutrition, or if you're a vegetarian or vegan, you make the associated adjustments so that you can make sure you're getting enough protein and amino acids, but it's in keeping with your ethical and maybe your health goals. Okay, so we're not here to discuss vegan, vegetarian, omnivore, of which I am, or carnivore. Okay, that's not the discussion. I think all of those groups agree that getting the majority of your nutrition from non-processed or minimally processed foods is going to be best. And that, of course, if you're human, sometimes you'll ingest processed foods, but really trying to avoid highly processed foods is critical. Now, with respect to the specific foods that can improve skin appearance and skin health, it's very clear that diets that are of the so-called low inflammatory type, that don't spark inflammation. So these would be things that sometimes are referred to as the Mediterranean diet or a paleo-like diet. You hear these terms, but what are we really talking about? Mostly whole foods, minimally processed foods, okay? And then there's variation depending on whether or not you emphasize or de-emphasize meat and fish, or emphasize or de-emphasize vegetables, this kind of thing. Again, I'm an omnivore. I love fruit. I love vegetables. I do like rice, oatmeal, and some pastas. I like a great sourdough bread. I like butter. I like olive oil. I like meat. I like fish. I think I am representative of most people out there because I eat most all those things, but I also eat the occasional croissant. I also eat the occasional slice of pizza. I don't eat a lot of that stuff, but I eat it now and again. And then, of course, you have people that are super strict. What do we know about the relationship between specific foods and skin health and skin appearance? Well, anti-inflammatory diet, we've more or less spelled out what that represents without getting into too many specifics. And then there are the specific components within foods, so vitamins, minerals, and micronutrients, as well as things like collagen present in bone broth that can be really useful to include. So one of the, I think, best accounts on dermatologic health and skin health and appearance on the internet is Dr. Andrea Suarez. She's a medical doctor, board-certified dermatologist, and she has a wonderful video that describes the various foods that one can eat to promote skin health and skin appearance. And rather than repeat that entire video, because A, that wouldn't be right, and B, it already exists out there in excellent form, I'll just give a brief synopsis of some of the things that she suggests, because I entirely agree. And again, there's no need to be repetitive. And she does an excellent job. So she certainly mentions collagen and bone broth. She also mentions various sources of omega fatty acids that are often lacking in people's diets that they should pay extra careful attention to get. So things like walnuts, flax, fatty fish. I personally am a big believer in supplementing with liquid form fish oil. That's what I do. Why am I a big believer in that? Well, I don't tend to cook much fatty fish. I love the taste of it if it's prepared right, but I don't tend to do that very often. So I use a liquid form fish oil or capsules, but the liquid form is generally more affordable. This was discussed in an episode that I did with Dr. Rhonda Patrick, so we can put a link to that particular segment in the show note captions. It's also suggested that we eat a lot of leafy greens, so dark leafy greens. You're probably noticing a lot of these recommendations are kind of typical for what people describe anytime they're talking about nutrition for health. She highly recommends people get enough folic acid for the role that folic acid plays in DNA synthesis and repair of skin cells, as among other cells, and cell proliferation. And of course, we should get our colored fruits and veggies, so our oranges, our strawberries. The reds and oranges are critical out there. And she also highlights something very important that I want to reiterate, which is that we have a critical need for vitamin A for our skin health. And this was covered, albeit through the lens of exploring the pharmacology of tretinoin and those retin A compounds. But vitamin A is crucial for a number of different processes within the cell types that make up skin. She appropriately cautions against supplementing with vitamin A because it's a fat-soluble vitamin. It's very easy to overdose vitamin A if one is supplementing with too much of it. She recommends rather getting enough vitamin A from things like oranges, carrots, sweet potatoes. She recommends as much berry intake as is appropriate for someone and one can afford. The berries are so delicious, but they tend to be expensive depending on time of year. Ingesting things like garlic, because garlic has sulfur. which is key for collagen synthesis and repair. And she talks about the critical role of taurine. Anyway, she does such a terrific job of describing the nutrition for skin health and skin appearance. Those are just a few of the highlights. So I do encourage you to check out that video. And her other content is spectacular as well. Again, she has an Instagram account, YouTube channel that are really wonderful. So again, without doing a deep dive into nutrition, decide whether or not you're going to be vegan, vegetarian, omnivore, or carnivore, and then make sure that you're getting enough of the vitamins and minerals and micronutrients from your foods, or supplement if necessary. But note that caution about vitamin A supplementation in excess. And also make sure you're avoiding excessive amounts of highly processed foods. I mentioned earlier these advanced glycation end products. These are things that are present in a lot of processed foods like crackers and chips and things like that make those foods inflammatory. So you're getting the theme now. Inflammation is bad, not just for the skin, but for all organ systems of the body. It's not just about the high density of calories and the high density of taste present in highly processed foods. Those are problematic, but a lot of the issue with these highly processed foods is the high heat conditions used to make those foods stable on shelves or stable in packaging over time. Okay, so there's a whole discussion to be had here that frankly I don't think can be had enough, but that is outside the scope of today's episode. The point is that when these highly processed foods are basically made, right, they're constructed, they involve the interactions between sugars and proteins and fats at high heat that make them stable on the shelf or in packaging, and those can be very inflammatory. And that can show up in the form of reactive skin. It can make your psoriasis worse. Yes, it can make your acne worse. It can make your skin more tender and painful. It can make your skin basically more reactive to some of the underlying predispositions you might have, either because of genetics or other things you're doing or not doing. Maybe you're going through a particularly stressful time. Maybe you're getting a little bit of extra sun and you're eating more highly processed foods, and those things are combining and making your skin break out or flush more than it would ordinarily. Again, there's so many reasons to eat most of your foods from non-processed or minimally processed sources. And of course, and now I sound like a broken record because you can hear this all over the internet, ingesting foods that are excessively high in sugar, excessively high in sugars combined with fats, just not good to do. Pro-inflammatory, it's going to cause all sorts of issues. And we're going to get into this more as it relates to acne in particular, because as you probably know, when you ingest foods that are high in sugars or even just carbohydrates generally, that also contain a lot of fats, and in particular when those foods are highly processed, well, then you initiate an inflammatory response, and you often can initiate additional things happening in the pores of cells that can start to really aggravate acne and cause more acne. This has to do with the whole insulin pathway. So when we talk about acne, I'll talk about diets that create a high glycemic load. We're not necessarily talking about the glycemic index of food. You may know that when people measure the glycemic index of food, they're looking at the blood sugar response after eating that food, typically in isolation and not in combination with other foods. What I'm talking about is eating combinations of foods that induce high levels of insulin, high levels of blood glucose, that then lead to all sorts of things in the hormone pathways and cell growth pathways that exacerbate acne. So we'll get there in a moment, but I think the take-home message around nutrition is pretty clear. So much so that I don't want to spend any more time on it. We all know what the best nutrition really is for us, regardless of whether or not you're vegan, vegetarian, omnivore, or carnivore. It's non-processed or minimally processed foods representing probably anywhere from, let's say, 75 to 100% of your food intake, depending on how strict you want to be. And then, sure, make some room if you want for some processed foods, but just know that those advanced glycation end products and the high glycemic load that comes from those processed foods can really exacerbate inflammatory responses in skin and set forward a whole domino set of issues related to hormone pathways and cell growth pathways that make everything, acne, psoriasis, and overall appearance worse. Yes, your skin will appear to age faster. And on the positive side, most of the foods that we think of as healthy and anti-inflammatory are actually quite delicious. So enjoy. And I forgot to say what's absolutely clear. You know that myth that they told us when we were teenagers? That eating a lot of fried food would make you break out, would make your skin worse. Guess what? It's true. That high heat preparation required for creating things as delicious as the donut or French fries, right? There's a reason people love these foods. They're so delicious. They do cause problems. They're pro-inflammatory. Does that mean you can never have a French fry? No. You decide what's best for you, but know what you're doing. As a segue to talking about acne, we need to talk about the gut microbiome. And this is a direct outgrowth of our discussion about nutrition. Here's the simple takeaway that I believe everyone should follow, not just for sake of healthy appearing skin, but also for sake of every organ and tissue system in your body, which is the data clearly show that ingestion of sufficient amounts of fiber, so prebiotic and probiotic fiber, so fruits, vegetables, sometimes this can also come from grains. Some people will supplement with additional fiber if they feel they need it, as well as ingestion of low sugar fermented foods. I've talked about this before, so regular listeners of this podcast may have heard this. Things like kimchi, sauerkraut, the sort of sauerkraut that has to stay in the fridge. So not the stuff that's stable on the shelf at room temperature. Anything containing a brine, that salty brine. So pickles, but not the pickles that are stable at room temperature, the ones that have to be kept in the refrigerated section of the grocery store. These low sugar fermented foods are powerful enhancers of the gut microbiome. And when the gut microbiome is healthy, you have reduced overall inflammation in the body. This is often reflected at the level of the skin. And basically, skin health and the youthfulness appearance of skin is enhanced, okay? This can also help with conditions like acne or psoriasis, especially in conditions where there's a direct immune system skin relationship that we'll talk about more in a little bit. Okay, so I highly recommend people have anywhere from 1 to 4 servings of low sugar fermented foods per day, or try and enhance the health of their gut microbiome generally. Maybe you take a pill probiotic, although those can be very expensive. There's a little bit of data suggesting that if you chronically take pill probiotics that yield very high levels of bacteria, well, then maybe there's some associated brain fog. That's a little unclear, pun intended. But, they are very expensive. They have to be kept refrigerated. And let's face it, low sugar fermented foods, if you find the ones that you like, are really great to ingest because they're tasty and they're good for you. Now, why am I talking about this? In part because we keep coming back to inflammation as a general issue for skin health. And that points us also towards some specific do's and don'ts as it relates to lifestyle. Let's face it, pun intended. If you sleep well, so maybe you need 6 hours, maybe you need 7, maybe you need 8, maybe you need 9, but if you sleep well on a consistent basis, your skin is going to look so much better, so much healthier, more vibrant than if you are not getting enough sleep. If you drink alcohol, and you wake up the next morning, your skin's going to look puffy. It's not going to look good. But many of you can ingest alcohol without issues. I've done an entire episode about alcohol. Yes, it's a poison. Up to 2 drinks per week for adults who are non-alcoholics is probably safe. 0 is better than any. But let's face it, alcohol is going to exacerbate most skin issues. This is just clear from the literature. Doesn't mean you never have a glass of wine. Doesn't mean you never have a beer or a cocktail if that's your thing. But alcohol consumed in excess, and it doesn't take much to get there, is going to cause sleep issues, microbiome issues, so indirectly and negatively impact the skin appearance and health, and indirectly and negatively impact the health of other tissues in your body. But it's clear some of that is reduced to increased inflammation, some is related to decreased sleep quality or duration. So get great sleep, avoid alcohol in excess, maybe avoid it altogether. Drink plenty of water. This sounds like such basic advice, but proper hydration is key. Get enough water and electrolytes. It absolutely will impact your inflammation levels by reducing them. It absolutely will impact your skin health and appearance in a positive way. So these are just basic things that I'd be remiss if I didn't mention. The other one is smoking and nicotine from non-smoked sources. So it's very clear that smoking, vaping, dipping, or snuffing is bad for skin appearance and health. Bad, bad, bad. Every dermatologist said this. Why? Well, with smoking, you can imagine why. Okay, a lot of carcinogens and toxic end products generated from smoking, even from vaping. Yes, even from vaping, it will make your skin age faster. That's clear. But it's also the substance itself. Why? All of those things, in addition to increasing inflammation, nicotine itself is a vasoconstrictor, so you're doing the exact opposite of what you want when it comes to skin health and appearance. And that's why people take things like BPC 157. That's why people take nicotinamide. That's why people are trying to improve the hydration status of their skin. So if you're somebody that's vaping nicotine or even taking nicotine in some other form, pouch or smoking nicotine, and you're interested in having youthful appearing skin, you are really shooting yourself in the face. And as we all know, our emotions impact the appearance of our skin. And yes, it can exacerbate so-called breakouts. And we'll get to that in a moment as to what the exact pathway is. But I've done entire episodes about controlling your stress. We have a master stress episode that talks about real-time tools that you can use, like the physiological sigh. Provide a link to a clip about the physiological sigh. It's the fastest way that I'm aware of to reduce one's levels of stress. This is something my laboratory has studied in detail at Stanford. There are also things you can do, and we're all aware of what they are: proper sleep, meditation, non-sleep deep rest. We'll provide a link for that. All things that we can do that are zero cost, very minimal time investment. Physiological sigh takes about 10 to 15 seconds. Non-sleep deep rest, aka yoga nidra, it's sometimes called, takes anywhere from 10 to 20 minutes per day. And that reduced stress can dramatically improve not just the health, but the appearance of your skin. And it makes perfect sense as to why that is. The stress hormones, such as cortisol, but other hormones too, such as adrenaline, when they are chronically elevated, because of the fact that adrenaline impacts vasoconstriction in the skin, it's going to reduce blood flow to the periphery, to the skin. It can cause all sorts of issues at the level of nerve endings that can lead to, believe it or not, enhanced flushing when we're under stress. This is why we measure the galvanic skin response, so not just sweating, but also blood flow and other things to the skin when we are studying stress. Okay, so direct relationship between stress and skin appearance. Learn to control your stress. Stress is part of life, but learn to control your stress in real time and through tools like non-sleep deep rest that are zero cost that can help you reduce your overall levels of stress, get great sleep. Don't use nicotine. If you do use nicotine, know what you're doing. Maybe use it sparingly, and please don't smoke or vape it, dip it, or snuff it. There are other forms, and I don't recommend those forms because they're very, very addictive. And keep in mind that things that improve blood flow, reduce inflammation, give you lower stress, better sleep, all of that is going to make you look more youthful. It's not an imagined effect. It is real. Let's talk about acne. Acne is very common. It impacts anywhere from 80 to 90% of young people at some point. Some people get very bad cystic acne, deep acne in the cheeks, on the back of the neck, the back. It can be very uncomfortable, very painful. Some people only get the occasional pimple, but they get them very deeply. They're very painful. And look, nobody likes acne. Nobody likes the appearance of acne on themselves. It can be very distressing for people. It can cause additional stress that then feeds back in terms of inflammation. And, I guess my first, request, I suppose, I can't tell people what to do and never do, but, for people that have acne, be compassionate, okay? Young people, be compassionate. I remember when I was younger, some of the kids with bad acne got teased, and it really upset me. It was really frustrating, especially when going through puberty, because there's this hormonal component to acne. Now, fortunately, there are things that we can do for acne. I'll provide a link to one of the major sources I used for researching this episode. I also, of course, spoke to dermatologists, one of whom really knows an exceptional amount about acne and its relationship to the immune system. The paper that I'm referring to now is a systematic review and network meta-analysis of topical, pharmacological, oral pharmacological, physical, and combined treatments for acne vulgaris, which is the technical name for acne. There are a lot of things that impact acne. Let's just briefly talk about what acne is. Anytime you talk about acne, you're usually thinking about pus or oil. That's called sebum. The sebum accumulates in essentially the follicle around the hair. This also occurs on non-hairy skin, or where there's just tiny little hairs that often aren't visible. That's why it's very unusual to get acne on, say, the glabrous skin of the palms. I suppose it could happen, but it's very rare. At any given moment, 10% of people worldwide will have acne. As I mentioned, up to 90% of young people have acne, so very common, very distressing. The accumulation of that sebum in the follicle can be due to a number of different things. Some of it can be related to androgens, things like testosterone, increasing the amount of sebum that's produced. Okay, this is why you often see acne during puberty. In addition, the anabolic, the pro-growth effects of androgens, such as testosterone, and by the way, these occur in both males and females, because both males and females have testosterone and estrogen. The androgenic effects of testosterone can also cause hypertrophy, growth of the hair follicle, right? So an increase in the number of keratinocytes, the cells in and around the follicle, which can compress that and hold some of that additional sebum beneath the surface, and that's why you're getting a swelling of what looks like a pimple or a cyst. So there's the potential for a hormonal influence on increasing acne. Now, if someone's going through puberty, you just have to deal with that increase. Now, if there's a sudden increase in acne when one is post-puberty, you may want to look at levels of androgens that are being produced. And nowadays, with increasing numbers apparently of things like polycystic ovarian syndrome, which in part relates to increases in androgens, this is becoming an additional concern. So getting a quality blood test, looking at androgen levels over time can be very beneficial for both males and females. Now, in addition, insulin that is related to our diet, so insulin and glucose generally go up together or down together, depending on whether or not we're ingesting foods or amounts of foods that greatly increase our insulin and blood glucose. So insulin is part of an anabolic pathway as well, a cell growth pathway, pro-growth pathway we should call it, that involves mTOR, mammalian target of rapamycin, that is a general growth signal for cells. So this occurs in the eye, this occurs in the liver. mTOR is involved in growth of cells of all kinds, including cells within the skin. When our diet increases the amount of insulin and glucose to a degree that is in excess of some threshold that's going to be different for everybody, depending on your activity levels, your metabolism, the way you manage insulin. When that happens, you get increases in mTOR that then can feed back on those androgen receptors, increase the levels of things like testosterone further, that then feed back on the production of increased sebum, that oily stuff, increased keratinocyte proliferation, and you get more acne. In other words, having a diet that has a high glycemic load or evokes a large insulin response can be problematic. So what to do? Well, we talked about it before. You want to eat mostly non-processed, minimally processed foods. You definitely want to exert portion control, right? You don't want to eat much sugar or sugar in excess. You don't want big spikes in insulin and blood glucose. You want to avoid an inflammatory diet. So again, fewer, if any, highly processed foods because of those glycation end products that we talked about before. And on the positive side, if one exercises something like, say, intermittent fasting, and here I don't necessarily think young people, especially people going through puberty, should do this because they're growing, they need nutrients. So you have to strike that balance between getting enough nutrients and not overloading the system with insulin, glucose, and calories. But things like intermittent fasting could be useful, or making sure that if you ingest complex carbohydrates, as I mentioned, I do, I'm an omnivore, that you don't do it in excess to the point where you're getting big spikes in insulin and blood glucose. All of this, the dermatologists tell me, can help serve to reduce acne. And while it might seem indirect, this relationship between testosterone and sebum accumulation, the relationship between insulin and mTOR and increased testosterone and sebum accumulation and growth of the keratinocytes, these are real pathways that have been established, and some of those are discussed in detail in the review. So much so that there has been the exploration of specific foods, in particular dairy and whey. We hear a lot about ingestion of whey protein. It's a very high quality protein, high bioavailability, high in the amino acid leucine, which for those of you that are interested in muscle building and repair, there's a lot of discussion about leucine being a critical component there. You want leucine, but it does appear that people that overconsume whey, people that overconsume dairy can run into issues. Now, does that mean you shouldn't consume whey protein? No, I take whey protein. Do I suffer from acne? No. If I did, would I reduce my whey protein intake? Well, I might decide to run a bit of an experiment where I reduce the amount of whey protein that I eat for a little bit and see how that goes. Should I reduce the amount of dairy I ingest? Well, here's where things get interesting. So in discussing this with a dermatologist who also happens to know a lot about nutrition, they told me something very interesting. A lot of people think that high-fat dairy will exacerbate their acne, but here's the situation. Non-fat and low-fat dairy has emulsifiers. This is actually based on work, I believe, some of which was done at Stanford, that can spike insulin more than full-fat dairy. So some people, in an attempt to reduce the amount of acne they're getting, will move from high-fat dairy, or full-fat, I should say, to non-fat milk or non-fat dairy or low-fat dairy, and their acne will actually get worse. And that could be because of the insulin spike associated with some of the emulsifiers in that non-fat and low-fat dairy. So what this means is that you don't have to avoid dairy altogether, but you might be better off ingesting full-fat dairy. You might be best off not ingesting any dairy at all. Maybe you want to run that experiment on yourself and just see what works and what doesn't work, or if there's no change at all. In addition, if you're consuming a lot of fried foods, so those French fries, you're ingesting cheeseburgers and things of that sort, it may not be so much the fat content of those meals, but rather the big insulin response that occurs when we ingest high-fat meals in combination with things like sugary milkshakes or fried foods. like French fries and things of that sort, that's leading to the acne by way of increased inflammation. Right? So there are a lot of different pathways: inflammation, androgens like testosterone, insulin leading to increases in testosterone and inflammation. A lot of pathways converge to exacerbate acne. And oftentimes it's just the removal or even just the reduction of some of this food intake or types of food intake that can really lead to big improvements in one's acne. So all of these things combine to support lower inflammation, appropriate amounts of sebum production, because you do need sebum production. You do need keratinocytes in and around the hair follicle, but you don't want too many of them, and so on. But what can be done to directly address acne? Well, there are a number of different prescription treatments that your dermatologist can suggest. But one thing that all the dermatologists agree upon is, first of all, getting adequate sleep, reducing stress, taking care of your gut microbiome, the nutrition recommendations that we've been talking about up until now. But also, get this is interesting, not over cleansing. A lot of people with acne will start to wash their face constantly and will often use harsh cleansers that can exacerbate that acne, either by virtue of removing some important skin microbiome components that then lead to even other infections like fungal infections or additional inflammation because you're removing that microbiome barrier. But they all recommend regular cleansing of the skin, usually 2 or 3 times per day, but not in excess of that, using a gentle, unscented, unfragranced cleanser. Okay, so there are a number of different types of these. I personally, basically my entire life that at least as far as I can remember, I've always used unscented, unfragranced Dove soap. Okay, I have no relationship to Dove soap. I'm sure people out there are going to say, oh my goodness, it contains a bunch of things that are bad for you, but that's what's worked for me, and not the liquid form, just bar soap. And there are things like Cetaphil. These are some brand names. And there are a bunch of other more sophisticated, gentle cleansers that one could use. There are also a lot of products out there that contain what's called salicylic acid. Okay, this is often as clear fluid that you put onto a cotton ball or a tissue and then you spread on the face. It's very important, very, very important that if
chasing dreams by the sea, echoes of a distant melody, in the lights just you and me, photographs and shades of gold, stories that we've never told, memories that never grow old. In this heart they're always bold. Time moves on, but we stay here in the moments crystal clear, echoes of the yesterday. In our hearts we hold them near, fading memories in the light, lost in whispers of the night. In the silence we take flight, holding on to what feels right. Walks through streets of neon glow, silent whispers, tales of woe. In the dark our secrets show, in this art our love will grow. Time moves on, but we stay here in the moments crystal clear, echoes of the yesterday. In our hearts we hold them near, fading memories in the light, lost in whispers of the night. In the silence we take flight, holding on to what feels right. In the twilight shadows play, awful whispers, tales of woe. In the hearts we find our say, in the dawn we'll never stray. Fading memories in the light, lost in whispers of the night. In the silence we take flight, holding on to what feels right. As the days turn into years, through the laughter, through the tears, in the echoes all our steers, in
If you're going to use these products, that you do it on clean skin, that is skin that's been cleaned with a combination of mild, zero fragrance soap and lukewarm water, okay? Because of the relationship between inflammation and acne, that's what gives it its red appearance. You don't want to use extreme temperatures of especially hot water when washing your skin. So lukewarm water, mild soap, and then, and only if it's been recommended by your dermatologist, this salicylic acid. Salicylic acid comes from the same class of drugs as aspirin. So it tends to reduce keratinocyte stickiness, right? The extent to which those cells stick together. Why do I mention aspirin? Well, you may have heard that some people will take aspirin to reduce the stickiness between their platelets in an attempt to improve heart health. We'll cover that on another episode at some point. But salicylic acid reduces the stickiness of the keratinocytes, so it can lead to less clogging of the pores by accumulation of keratinocytes, or I should say by less accumulation of the keratinocytes, and it can reduce swelling in and around the area related to the acne. Sometimes if people get an acne pimple, especially if they have an event or they don't want to be seen with that pimple, the use of a little bit of corticosterone cream put on there can reduce the redness or swelling. The dermatologists tell me you should absolutely not pop your pimples. Part of the problem when you pop a pimple, I know there are entire videos about this online. I know, please don't go look at them. The whole community is around this. It's super gross. But I know people find it very satisfying in some cases to pop these pimples, get the infection out. While there are certain use cases for that, where someone has an infection, it just absolutely needs to get out, then be cleaned, then covered with a bandage and maybe some topical antibiotic. That would be a use case for that. The dermatologist practically begged me to tell you, don't pop your pimples, because A, they will go away in not too much time if you leave them alone, and B, you can always put a little bit of corticosterone cream on top of them to reduce the redness or swelling. But most importantly, they tell me that when you pop those pimples, what ends up happening is you get a physical disruption of that area, which to you might just seem like, okay, whatever, it turns a little bit red and that's transient, but you get the influx of what are called matrix metalloproteases. These are enzymes, and remember, anytime you hear an ACE, it's usually an enzyme, matrix metalloproteases, that then and go eat at the extracellular matrix, and then you can get an indentation scar that is permanent, okay? So if you're concerned about the appearance of your skin, avoid popping those pimples. I know it can be hard to do, but really try and avoid popping pimples. It can lead to scarring because of the matrix metalloproteases and the eating away of the extracellular matrix. Keep the area clean, cover it up if you need to, get some corticosterone cream on there if you want to reduce the redness. If it's really bad and you have some big important event like you're getting married tomorrow and it's right on the tip of your nose or something like that, then you can potentially go to the dermatologist and get it injected with a corticosteroid to reduce the redness in a more potent way. But they did ask that I ask you to please not pop your pimples. And if you're somebody that suffers from acne, I'd like you to know I provide a link to a paper in the show note captions entitled Acne and Diet, a review of pathogenic mechanisms. And I also provide a link to the review I mentioned before that covers all of the other aspects of treating acne: topical, pharmacological, oral pharmacological, physical, and combined treatments for acne vulgaris. Because again, I do sympathize with the fact that acne can be very distressing, very painful. Fortunately, there are a number of different avenues that you, without a dermatologist, but ideally you and a dermatologist, can use to attack acne at the level of inflammation through diet, through lifestyle, if needed, prescription medications, and again, gentle cleansing and thinking about the various things that indirectly will impact that acne. So much so that a few of the derms told me that they have patients, young and old, who will be suffering from really bad acne that will sometimes just make a few adjustments to their diet, the exclusion of certain things, mainly highly processed foods, maybe reducing dairy a little bit or whey a little bit or completely, and increasing the amount of things that reduce inflammation, so more fruits and vegetables and meat, fish, eggs from healthy sources, and seeing dramatic improvements in acne. So that's always reassuring to hear. It doesn't always require prescription medication, but if you need it, you should take it. Okay, let's talk about rosacea. Rosacea is reddening of the skin, and some people suffer from this pretty severely, other people mildly, some people transiently, but it tends to be kind of distressing for people. And the reason it's distressing is that it can look like blushing or flushing of the face when in fact one isn't emotionally embarrassed. However, being embarrassed or having any flushing of the skin can exacerbate existing rosacea. So it's thought to be caused by a combination of genetics. There can perhaps be some, again, overinflammation of the skin, which probably reflects inflammation more globally at the level of the gut and body, etc. We've been talking a lot about that today. And there are things that can exacerbate rosacea, such as alcohol intake or anything that acts as a vasodilator that dilates the vasculature innervating the skin. So the approach to treating rosacea is pretty much similar to the other things that we've talked about: consuming a low inflammation, low glycemic load diet, trying to get enough sleep, keeping alcohol intake in particular to a minimum, or cutting out alcohol completely. The reason I say in particular is that a lot of people that suffer from rosacea who cut out alcohol completely essentially eliminate their rosacea or dramatically reduce it. So oftentimes it's alcohol that's the culprit, either directly or indirectly. We don't know. Again, alcohol is a poison, but could be the indirect manner in which alcohol impacts sleep and the gut microbiome negatively that's causing the rosacea. Without knowing the direct or indirect mechanism, reduce or even eliminate your alcohol for a bit and see if your rosacea improves. That will give you a strong indication of what might be going on, and even better, it could give you a potential solution to the problem. Now, for those that don't experience a reduction or elimination of rosacea, if you eliminate alcohol, get your sleep right, get your diet right, there are some additional things you can do. First of all, you want to follow the same recommendation we talked about for acne, which is also the general recommendation for skincare. Use lukewarm water, not excessively hot or cold water, a gentle, unfragranced cleanser. You want to use sunscreen regularly. Remember, sun damage to the skin is also inflammation, so that's going to exacerbate rosacea. And of course, sunlight, because of the release of nitric oxide, is also going to act as a vasodilator. Does that mean you have to go full beekeeper mode? No, it doesn't. You can if you want to, I suppose, but use a quality mineral-based sunscreen, which we talked about earlier in the episode. And you should use some sort of moisturizer to help lock in the moisture within your skin. You could use things like hyaluronic acid, or use any kind of gentle moisturizing cream that's not going to cause inflammation or kind of irritate the skin in any way, and can keep the moisture within the skin. And there are a lot of different versions of these available out there. And frankly, a lot of them are not terribly expensive. You can find super expensive varieties of any and all these things. But many of the things that meet the criteria of gentle, unfragranced cleanser, SPF 30 mineral-only sunscreen, as well as a quality moisturizer, are not necessarily the most expensive available. And, what justifies the higher expense in some cases could be, the silkiness or the packaging. It could be any number of different things. I'm not going to say that the cheapest varieties are necessarily as good as the most expensive varieties, but I do think, and the dermatologist that I spoke to definitely confirmed, that there's a lot of price inflation out there related to kind of the overall milieu of packaging and purported exclusivity of certain skincare products. Look for the things that meet the criteria you are trying to establish for your skincare. But just like with acne, just like with general skincare, if you have rosacea, you want to think about mild treatments for the skin at the level of cleaning, at the level of sun protection, at the level of locking in moisture. And then there's some additional things that, if you can spare the expense, could also be beneficial, like niacinamide, as it's also called. Or there's also been some evidence that things like licorice root can be of benefit. Okay, these things are typically found as a topical ointment or in a topical ointment. But in the case of niacinamide, we talked about how this can be available in an ointment form, a topical form, or it can be taken as 2 500 milligram dosages per day. I gave you the long list of the various mechanisms by which it can improve skin health, reduce inflammation, production of collagen, etc. All of that still holds for the potential treatment of rosacea. Be sure to avoid any kind of things that are acting as strong astringents or that increase heat. So people who have rosacea will often try to avoid hot peppers, so spicy foods of any kind. I know that's tough. I'm somebody who really enjoys spicy foods. So if you have to avoid spicy foods, I sympathize with you. That's rough. Anything that acts as an astringent or can, really irritate the skin from the inside or from the outside. So think not excessively hot foods as it relates to spicy or temperature, things of that sort. Now, I should point out there are different types of rosacea. The dermatologist I spoke to, who is expert in rosacea, told me there are 4 major types of rosacea. Many of them respond to the sorts of guidelines that we've been talking about up until now. Some of them that also include acne need some additional treatment. We talked about acne treatments that can be easily folded into the treatment for rosacea. There are people who have very stubborn rosaceas. This may be due to excessive use of cleansers. And again, we're talking about how over-cleansing can really be a problem. So we're not saying don't wash your face. We're not saying don't take a shower. Please do. In fact, and I should have said this earlier, by the way, for a lot of reasons related to your comfort and appearance and other people's comfort, after you work out at a gym, regardless of whether or not you're rolling around on the floor with a foam roller or you're rolling jujitsu or you're lifting weights, you're doing cardio, it is a good idea to take a shower and cleanse with a gentle cleanser as soon as possible. I know this sounds like just basic advice, but a lot of people just throw on a clean shirt or they don't rinse off or they don't wash their face and they're wondering why they're getting all sorts of skin issues. Well, there's a lot of bacteria in gyms, a lot of sweating people. There are a lot of bacteria on you, a lot of bacteria on the equipment. And yeah, you can spray down the equipment and do these various things, but it's a good idea to shower as soon as possible, or to bathe rather as soon as possible. Wash your face after going to a gym for your sake and for the sake of others. Now, some rosacea is very stubborn, meaning it does not go away even if somebody makes all the appropriate lifestyle adjustments, tries any number of different medical treatments. And by the way, rosacea is a medical condition. And in some cases, people will get angiomas, the accumulation of blood vessels near the surface of the skin that can be, for them, something they don't want. So we could say unsightly, but they just don't want it. Or in some cases, they'll treat their rosacea and then they'll get an accumulation of broken vessels near the surface of the skin. This is pretty common for people that experience rosacea and treat rosacea. For these people, there is a treatment. It has to be done in a dermatologist's office called pulse dye laser, where they use a laser of a particular wavelength that can penetrate, the superficial layers of the skin. And now you know how different wavelengths of light can penetrate to different depths within skin and destroy the blood vessels or the broken blood vessels that then call in immune system cells to clear out the destroyed endothelial cells and other stuff around it and take it away, get rid of those blood vessels that sit beneath the surface. Let's talk about psoriasis. So when I was researching this episode, I asked the dermatologist, is psoriasis related to yeast or overproduction of skin cells? And what they told me was really interesting. They said for more than 80 years within the dermatologic community, it was thought that psoriasis was just an overproduction of skin cells, but it wasn't really known what the source was. And it turns out that now almost all the derms, at least the ones I spoke to, said that it has something to do either directly or at least powerfully and indirectly with the immune system. So what can be done to treat psoriasis? You can probably guess. Things that reduce the overall level of activation in the immune system. Not so much that you become susceptible to infections, because that's not good, but you treat this like any other autoimmune condition. There are now drugs, these are prescription drugs, that directly target the interleukins, the components of the immune system that are directly involved in psoriasis, such as interleukin 17 and interleukin 23. And I'm told that these drugs are very effective in the treatment of psoriasis. So that's very reassuring. I know, especially in communities online that are focused more on behavioral tools and nutrition-based tools or supplementation-based tools, of which I am, right? We focus on those. But as you probably noticed in this and other episodes of the Huberman Lab podcast, we also talk about prescription drugs that have proven to be very effective in certain conditions. So it's very reassuring to hear that there are excellent prescription drugs that can target the specific interleukins that are overactivated in psoriasis, because psoriasis is now known as an overactivation of the immune system and a kind of turning of the body on itself, if you will, to create this itchy, scaly, uncomfortable, and in some cases unsightly overproduction of skin cells at the scalp and elsewhere. Okay, so we've covered a lot of topics thus far. We've talked about skin biology. We talked about various skin conditions that are very common, such as acne, psoriasis, and so forth. We talked about ways to increase the youthfulness or the appearance of youthfulness in skin that are based on data, some that are a bit more experimental. And we talked about even some laser procedures and phototherapy, things of that sort. And at the same time, I acknowledge that there are many topics and conditions related to skin health and skincare that we did not talk about. We didn't talk about eczema. We didn't talk about Botox. We didn't talk about an enormous number of topics that I know are of interest and relevant to many of you. So as a consequence, the plan is to host various expert guests, both dermatologists, expert in particular areas, as well as, yes, a cosmetic surgeon who, believe it or not, does not like to cut, but rather likes to use fairly non-invasive procedures that touch on some of these very same mechanisms. Yes, injections of certain things, things that operate at the surface level of the skin, and sometimes surgical procedures that, I know when people hear cosmetic surgery, they think, oh, people just trying to improve the youthfulness of their look or something of that sort. But, that also relate to certain serious skin conditions for which surgery and non-surgical approaches can assist in. So the point is that any discussion about skin health and skin care is going to be an ongoing discussion, one that I do plan to continue on this podcast in the form of expert guest episodes, maybe even another solo episode. We've occasionally done so-called toolkit episodes where we summarize some of the main points of previous solo episodes and that arrive with guest episodes and that reflect the latest knowledge that gets published in between episodes. I do plan to cover this topic in more detail going forward. Meanwhile, I like to think that what I've covered today provides at least an introduction to the biology of skin and an understanding about the various things that we all can and should do for our skin health and appearance. as well as ways to attack certain pain points related to certain skin conditions that come from expert sources, from excellent literature that has been established over many, many decades. And I personally find this organ that we call skin to be infinitely fascinating, not just by virtue of what it does, but by virtue of all the different organ and tissue systems that it interacts with in our body, and by virtue of the fact that our skin is this incredible living organ on the outside of our body that tells us oh so very much about how we and others are doing in terms of our immediate and potentially our long-term health. If you're learning from and or enjoying this podcast, please subscribe to our YouTube channel. Please also subscribe to the podcast on both Spotify and Apple. That's a terrific zero-cost way to support us. And on both Spotify and Apple, you can leave us up to a 5-star review. Please also check out the sponsors mentioned at the beginning and throughout today's episode. That's the best way to support this podcast. If you have questions for me or comments about the podcast or topics or guests you'd like me to consider for the Huberman Lab podcast, please put those in the comments section on YouTube. I do read all the comments. For those of you that haven't heard, I have a new book coming out. It's my very first book. It's entitled Protocols, an Operating Manual for the Human Body. This is a book that I've been working on for more than 5 years, and that's based on more than 30 years of research and experience. And it covers protocols for everything from sleep to exercise to stress control, protocols related to focus and motivation. And of course, I provide the scientific substantiation for the protocols that are included. The book is now available by pre-sale at protocolsbook.com. There you can find links to various vendors. You can pick the one that you like best. Again, the book is called Protocols, an Operating Manual for the Human Body. If you're not already following me on social media, I am Huberman Lab on all social media platforms. So that means Instagram, X, formerly known as Twitter, Threads, Facebook, and LinkedIn. And on all those platforms, I cover science and science-related tools, some of which overlaps with the content of the Huberman Lab podcast, but much of which is distinct from the content I cover on the Huberman Lab podcast. So again, that's Huberman Lab on all social media platforms. If you haven't already subscribed to our Neural Network newsletter, our Neural Network newsletter is a zero-cost monthly newsletter that includes summaries of podcast episodes, as well as protocols in the form of brief 1 to 3 page PDFs that explain protocols for things like deliberate heat or deliberate cold exposure, for optimizing dopamine, for improving your sleep, for neuroplasticity and learning. Again, all zero cost in the format of 1 to 3 page PDFs. To access it, you simply go to hubermanlab.com, go to the menu tab, scroll down to newsletter, and enter your email. And we do not share your email with anybody. Thank you for joining me for today's discussion all about skin health and skin care. And last, but certainly not least, thank you for your interest in science.